Good afternoon. My name is Ludmila Galushchak. Our group presentation focuses on UK's childhood obesity crisis. We will explain the cause and trends, scales of childhood obesity, the health and social care consequences, the policy interventions the UK government has introduced, and its effectiveness. Now I will tell about some factors which caused obesity. Childhood obesity is one of the most pressing health challenges in the United Kingdom. This condition is caused by a variety of factors, such as unhealthy diets, lack of physical activity, genetics, social and economic circumstances. Recent evidence shows that children who are living in poorer areas are more likely to suffer from this condition than children from wealthier areas. Now I would like to add some statistics. The main source of the UK childhood obesity statistics is National Child Measurement Programme. It has measured child's height and weight of children in the United Kingdom in state schools since 2006. The most recent data covering 2024-2025 school year measured over 1 million children and found very interesting facts. 10.5% of children in reception were suffering from obesity. It is the highest recorded level since the COVID 2019. 22.2% of children in year 6 were suffering from obesity as well. This means that more than 1 in 5 children leave primary school with this condition. The number of children who are obese are more than doubles during primary school years. Another worrying factor is severe obesity. 2.9% of children in reception and 5.6% of children in year 6 were suffering from severe obesity. The main trend we can see here is the obesity increases when children get older, and some of the children are suffering very severe levels of this condition. This highlights the importance of early prevention and health education for improving children's health. Juliana?
My name is Juliana Oforiwa. Today, I will explain what this statistics tells us about childhood obesity. This table compares children living in the most deprived areas with children living in the least deprived areas. Deprivation means that families may have lower income and a few resources such as access to healthy food, safe places to play, or other opportunities that support good health. For children in reception who are 4 to 5 years old, 14% sorry. 14% have 14 percentage points of children living in most deprived areas have obesity. In the least deprived areas, the number is 7.1 percentage points. And this means that the children living in the most deprived areas are about 2 times more higher likely to have obesity. For children in year 6 who are 10 to 11 years old, the difference is even bigger, around about 29.3 percentage points of children in the most deprived areas have obesity, compared with the children living in the least deprived areas. This shows that the gap becomes larger as children grow older. The second table looks at severe obesity in reception. 4.6 percentage points of children in the most deprived areas have severe obesity, compared with 1.5 percentage points of in the least deprived areas. For year 6, this increases to 9.9 percentage points compared with 2.2 percentage points. This means severe obesity is about 3 times higher in reception and 4 times higher in year 6 children living in the most deprived areas. The table also tells us that obesity rates can vary between different ethnic groups. For example, children of Black African heritage have higher obesity rates. Thank you. Eva.
Eva Yeboah. I'm here to speak on causes of obesity. The causes of childhood obesity viewed across 3 intellectual levels. They are individual factors, family and community factors, and societal factors. The individual factors are genetics, diet, physical inactivity, sleep, sedentary behavior, and psychological health. The family and community factors are parenting practices, household income, food availability, schools, and neighborhood safety. The societal factors are food marketing, urban design, government policies, socioeconomic inequalities, and food pricing. Causes of obesity. Causes: poor dietary habits. It explains that regular consumption of energy-dense, nutrient-poor food and sugar-sweetened beverages leads to excess calorie intake. The examples are fast foods, confectionery, processed snacks, sugary drinks, and oversized portions. The second cause is physical inactivity. It explains low levels of moderate to vigorous physical inactivity. Physical activity reduces energy expenditure. Examples are lack of outdoor play, limited sports participation, reliance on motorized transport. The third cause is sedentary behavior. It explains excess time spent on screens is associated with reduced physical activity and increased snacking. The examples are television, smartphones, gaming, social media, and streaming services. The fourth cause is genetic predisposition. It explains multiple genes influence appetite regulation, metabolism, and fat storage, increasing susceptibility to obesity. The examples are FTO gene variant, MC4R mutations, family history of obesity. The fifth cause is family and parental influences. It explains that parents shape children's dietary patterns, physical activity, and lifestyle behaviors. The examples are parental obesity, unhealthy home food environment, poor nutrition knowledge. Thank you. Sister Dorothy.
My name is Dorothy Ufusu Asantinoma, and I'm going to continue to talk about the causes of obesity. The first cause is about psychological factors. Emotional distress can contribute to overeating and reduce physical activity. Examples are stress, anxiety, depression, emotional eating, and bullying. Parental and early life factors also cause obesity. Conditions during pregnancy and infancy influence later obesity risk. Examples are maternal obesity, gestational diabetes, excessive gestational weight gain, smoking during pregnancy, rapid infant weight gain, and lack of breastfeeding. Medical conditions and medications can also cause obesity. Some diseases and medications can contribute to weight gain, although they account for a small proportion of childhood obesity. Examples are hypothyroidism, Cushing's syndrome, and antipsychotics. Cultural and behavioral factors also contribute to obesity, which is cultural norms and eating practices may influence portion sizes, food choices, and attitude towards body weight. Examples are frequent celebrations involving high calorie foods, perceptions that heavier children are healthier. We also have marketing and advertising. It can also cause obesity by exposure to unhealthy food advertising, influences children's food preferences, and purchasing requests. Examples are television adverts, digital marketing, social media influencers, and product placements. We also have built-in food environments that can also cause obesity massively. Environments that promote unhealthy choices of food and discourage physical activity contribute to obesity. Examples are high density of fast food outlets, limited parks, and unsafe neighborhood. Thank you, Shade.
My name is Chelina, and I'm going to talk about the impact on health and social care. And when we talk about the impact on health and social care, we have to divide it into three categories: clinical, psychosocial, and healthcare system itself. Clinically, obesity is a major risk factor for early onset type 2 diabetes, a condition that was historically almost unknown in the UK, but is now recorded from as young as 9 years old. alongside heightened risk of liver, kidney, pulmonary, and orthopedic disorder. Obesity in childhood also tracks strongly into adulthood, increasing lifetime risk of cardiovascular disease, several cancer, and mental health illness. Obesity has psychosocial consequences, including a stigma, bullying, and reduced well-being, as it generates substantial downstream cost to NHS and social care services through the treatment of weight-related long-term conditions across the life courses. Next, I'm going to talk about the policy interventions. When we talk about policy interventions, we have to talk about sugar drink industry levy, which is a sugar tax. This tax was introduced in April 2018. Tax manufacturers according to the content of soft drink, incentivizing reformulation. Also, we have to talk about restrictions on advertisement ensured in the Health and Care Act 2022. There is a ban on pay of online advertisement of high in fat, salt, or sugar products and before 9 p.m. on television. The 10-year health plan for England plan for change. This policy was introduced in 2025, seek to review and strengthen the school food standard, restrict multiple buy promotions of HFSS product from October 2025. Introduce mandatory healthy food standard and reporting for large food companies. Increase the value of Healthy Start voucher for lower income family by 10%. Update the nutrient profile model used to define which products are restricted from marketing and double access to the NHS Digital Weight Management Program. Then the last one, we have NICE guideline NG246. Shade?
Good afternoon. My name is Afala Shade Fetiga. So I'll be discussing all about childhood obesity. So this is all what we discuss. It can be observed that the UK has implemented several childhood obesity policy, including the soft drink industry tax, which has reduced the sugar content in drinks. The prevalence of obesity is seeing no downward trend, with about 22% of year 6 children living with obesity, with most of them from the least deprived areas. This implies there exist challenges with the implementation of policies, as the attributes of obesity are multifaceted: environmental, the social, the economy, and the behavioral. For the government to tackle the issue of obesity in children, a holistic approach must be adopted to fully address the multifaceted barriers or challenges. So in our conclusion, the UK has one of the world's most comprehensive childhood obesity policy frameworks. While individual policies, such as the soft drink industry levy, have demonstrated measurable success, overall, obesity rates remain high and socio-economic inequalities persist. In future progress will depend on sustained all-system intervention that address the wilder determinants of health. Thank you so much.